So this is Dr. Ravi Kamapale. I'm an infectious disease, wound care, and obesity medicine board certified physician in Georgia, in USA, and I'm a founding member of Indian Podiatry Association, which I had the pleasure of being a part of starting this organization since 2008 and 9, when we had seen a need for this organization in diabetic foot care needs that have to be met across the subcontinent of India. And essentially, Indian Podiatry Association is celebrating International Save a Feet Day on October 8, 2022, and I'm doing this presentation standing on one foot to notice and spread the word that we have to have the ability to spread this foot care, as it is the way in which healthcare is going to be very important because of rampant metabolic health problems and that related diabetic foot problems that we're seeing. As a part of this, I'm presenting a small study that statement, that policy statement from American Heart Association that wants to reduce amputations by 20% by 2030, which I think is an audacious task for non-traumatic amputations. But I'm very worried that it's not possible, because most of all these organizations have a problem with creating audacious goals, but not targeting the root cause of why all these problems are happening. The food we eat is the real reason why we are facing this epidemic of diabetic foot problems, and metabolic health matters a lot. And in this end game of sick care that we are playing, we are really not addressing and teaching that food and nutrition and metabolic health prevention as an approach in preventing the diabetic foot ulcers. Hence, this presentation to quickly bring that to the forefront as a part of this effort from this organization. So this is like a national inpatient sample in US that was done to look at lower extremity amputation rates depending upon the data from discharges per 1,000 per year. And this was compared to diabetic and non-diabetic population. And if you're able to see this, the minor non-traumatic amputation diabetics were less, whereas non-traumatic amputations in diabetics were higher. The same was with total amputations when compared to diabetic and non-diabetics. In diabetics, it is higher. And also, the major other issue that has to be looked at is fourfold increased diabetic amputations in Black African Americans, and also when compared to the non-African American population in compared to the leg amputations. Also, this is more so even after angioplasty or revascularization procedures are done. So we have to understand that this has a lot to do with possibly the genetic makeup of the patients, but also food and nutritional habits that have to be changed. And that is where my focus is on trying to spread the knowledge of understanding of metabolic health that matters more. But also to prevent, the key role in preventing this non-traumatic amputation is needed to be coming from policymakers, payers, public and healthcare professionals, and research has to be done a lot more in reducing this. It cannot be one excellent university-based solution, but it has to be a public health initiative. And this is mostly achieved by establishing multidisciplinary wound care teams, wherein we will need medical professionals that are experts at early detection of diabetic problems, and vascular specialists where we can timely refer to a vascular specialist, and podiatrists and wound care specialists are needed, and also appropriate infectious disease consultations and close monitoring with wound care, home health, and also appropriate nutritional solutions, including now trying to look at metabolic health using obesity medicine aspect of solution, including insulin resistance, have to be targeted. So we need to establish standardized wound care programs, which are out there, but all these programs are not addressing the personalized solutions that the patient need. We need to be targeting, identifying peripheral artery disease, preventing and targeting smoking cessation and appropriate diabetic therapies, including reversal of diabetes options that have to be established and also tapered and treated and coordinated. So in this endgame of medicine, the poor metabolic health is often ignored by healthcare, which is causing the end organ damage, the diabetic foot infections and hepatic problems, including NASH, and ectopic fat accumulation, and peripheral neuropathy and pancreatitis. All of these are causing the severe problems of metabolic crisis, including hyperlipidemia with high triglycerides. All these are preventable, but the key challenge is, are we able to make up to this challenge? Are we training our health professionals to make sure that they identify it? Are we creating the processes? The problem I see is most seen also with COVID. If you see, we're talking about isolation, quarantine, all these hand hygiene, and all these are very much needed. But what we are not advocating is the metabolic fitness. This healthcare, as it is now, is fragmented, like these blinded professors trying to find a reason for the problem. We have to fix the healthcare. We cannot fix it unless we fix what is causing the problem, which is the nutrition. And unless we understand that root cause, we cannot move from whole in a person to a whole person thinking that is needed to fix this fragmented healthcare. We have to understand that, and also understand that in US healthcare, most costs of health are really in the medication aspect, where we are using all the medications, including lipid-lowering medications, anti-diabetic medications, ACE inhibitors, proton pump inhibitors, which are all needed to correct the symptoms of the problem. But then, as we correct the symptoms of the problem, we have to be able to remove and introduce nutritional aspects to this. And also, we have to understand that CMS, as it is noted to have spending around $348 billion in 2020 just for medications. And unless we evolve and review, assess, plan, and communicate, create these communication tools and monitor outcomes, we will not be able to improve the outcomes of our patients. We need to move from the sick care. We need to be this clinician that is able to break this barrier for the patient, and that is when real healthcare is going to happen. We need to stop. There is this end game of medicine. There is no real magic pill for proper human nutrition. And we have to understand that addiction blinds us all, and all these are a consequence of processed food. And on this International Save Feed Day on October 8, 2022, IPA, Indian Podiatry Association, is calling all the foot care doctors, all the wound care doctors, all the medical professionals to avoid mass medicine mindset. We need to move from that M3 medicine to N equal to medicine, N equal to 1 medicine. And we just have to do it. To accomplish great things, we must not only act, we must dream, but not only plan, but also believe. And we call on all people in the world to look at healthy feet as a part of healthcare approach, and from a whole person, from a whole in a person to a whole person approach. Thank you very much, and have a great day, and make it a great day for foot saving. And please make sure that your motto is I prevent amputation, as is the motto for Indian Podiatry Association. Have a great day, guys.